Ladies and gentlemen, I want you to give another warm welcome to the class of 2018. Have your seats, please. I'm sorry for the little late start, but traffic was a little tough. I would like to welcome you all to St. Francis College on behalf of the Board of Trustees, our president, our provost, the faculty, staff of the college. I would like to welcome you to our second white coat ceremony. That is a very important thing for us and a very important thing for our nurses, future nurses. Let me just start by saying a few words. My name is Dr. Alan Brodowski. I'm the Academic Dean of St. Francis College, a professor of biology. And for those of you who don't know, sometime for you in your second year, actually next year, you are going to have the honor of taking the easiest course in nursing pharmacology. And I will be glad to have a lot of fun teaching you that subject. But I really want to congratulate you. Would like to congratulate your families, your friends, your loved ones of really an incredible achievement of becoming part of this class. This is truly very, very important. I realize, for the most part, that you cannot do this alone. I like saying this to students in many, many occasions because you are really not alone. You have the faculty to turn to, you have each other to help, but most importantly, the way you succeed is with the help of your parents and your friends and people who will support you, I understand, financially, emotionally, academically. And that is really what I call a true team effort, a very, very important team effort. You likely believe that for the most part, you're really at the beginning of a journey. But in reality, you really have accomplished a great deal. You've succeeded at maybe the core of the college. You've succeeded in anatomy and physiology and all the prerequisite courses that you need to start a nursing career. And you have distinguished yourself by becoming a member of this nursing class. And again, I applaud you for that. It's been a difficult road. However, there are many more milestones and miles to travel and many more challenges to experience, which I know you will succeed in any way that you can. Very, very important. And unfortunately, one of the first things you have to survive is me speaking to you. As a college professor, I do speak in 45-minute slots, but I will try not to. I've been informed by the chair of the department that there's a hook waiting for me. The white coat ceremony for us represents a great deal. But for nurses, it's relatively new. So let me explain why we have a white coat ceremony and why we think it's important. The white coat ceremony for nurses really represents, for the most part, an honor for incoming members of the profession, as well as welcome you to becoming a member of a healthcare team. Many years ago, when you finished nursing school, as our nurses know, you went to a capping ceremony. Today, at the end of your journey here, we will have a pinning ceremony that really allows you to enter into the profession. But a few years ago, we started this white coat ceremony, and it is a relatively new rite. It's the second time we're doing it in St. Francis history, but kind of interestingly, it really honors you as nurses because of the key role that you will be playing in healthcare, and recognizes, most importantly, which many of you may not realize, it recognizes a parity with other healthcare professions. Very, very important. Nurses today share the same ideals as any other healthcare professional, right? And what we want to do is include you in that ceremony. So we want to create a stronger sense of community among all healthcare workers and now welcome them into a healthcare team. I really hope, and we hope, at the faculty hope here, that you all get to share a sense of pride in your accomplishments and engender a sense of responsibility in providing passionate, caring care to your patients. White coat ceremonies really started at the University of Chicago Pritzker School of Medicine in 1989, relatively young, but the first full-fledged ceremony was at Columbia University College of Physicians and Surgeons. It is a rite of passage that takes place today in nearly every medical school in the United States and Canada and 13 other countries. And most recently, really starting in 2014, nursing schools have started to introduce a white coat ceremony. Many other healthcare professions do that, but in 2014, it was started. And today, as I'm speaking to you with our white coat ceremony, we are joined by 160 other schools of nursing that have adopted the white coat ceremony to welcome their students into the profession. The president of the AACN, President Eileen Breslin, really said this: by offering the white coat ceremony, our schools are sending a very clear message to new nursing students that compassionate care must be a hallmark of their clinical practice. So this is setting up a commitment in providing patient-centered care at the beginning of your professional career. And we hope that it will raise the quality of care to your patients. Since I'm an academic, I must quote Voltaire. Voltaire said, and this is something for you to keep because it's very much in line with the Franciscan spirit that we share at St. Francis College. Those who are occupied in the restoration of health to others by the joint exertion of skill and humanity are above all the great on earth. They even partake of divinity, since to preserve and renew is almost as noble as to create. Welcome to the healthcare team. Congratulations. And now, I'd like you to welcome Dr. Kehoe, our new chairman of the nursing department.
Thank you, Alan. I'm not going to talk as long as Alan did. I'm not really academia, I'm more nursing. I do want to say what Alan said. Welcome to our second annual white coat ceremony. And now at this time, it's my privilege to introduce to you Sister Helen Marie Cahill, also Dr. Sister Helen Marie Cahill, who will do the invocation for tonight.
O Lord, we ask your blessing upon this assembly as we gather to celebrate a sign of advancement of our nursing students in the field of medicine. They have chosen to answer your call to serve the sick and the suffering of this world, to nurture them back to good health. Give each of these students a willing spirit, skillful hands, and above all, a sensitive heart. Help them to do well in their studies so that they who are in need may know the touch of their gentle care. We ask you to hear this prayer, and we thank you for your love, which is always with us. Amen.
Right now, it's my pleasure to introduce a guest speaker for tonight, Anne Beauvais. Anne is a registered nurse with a master's degree. She does all the clinical placements for us, for our nursing students, just about all of them. And she also is a staff educator, head of staff education at Bellevue Hospital. But yeah, well, as far as we're concerned, you are, Anne. That's all that matters. That's all that matters. Anne is a very gifted nurse and an excellent speaker, and we want to welcome her here tonight to give an address to our students and to you.
Thank you, Dr. Kehoe. Also, the significance of today, May 12th, is Florence Nightingale's birthday, right? The mother of nursing, all right? And everybody has a tendency to kind of think about Florence Nightingale as the little lady with the lamp, very submissive, whatever. But if you ever really read about her, and you ever really looked into the content of the body of her work, she was anything but a wallflower. She truly was an advocate of her time. She was very much into women's rights, women's issues, and in a sense, saw the suffragette framework within England as a framework of where women should be going. And in fact, Florence Nightingale influenced, through correspondence, the first school of nursing in the United States to follow her framework, and that was the Bellevue School of Nursing. And what she did was she wrote a letter to the Board of Trustees of Bellevue. Bellevue has its own history. It's the oldest public hospital that's continuous in terms of service in the United States. Started in 1736, always been an almshouse, always treated everyone that came to its door. Still does. No matter who you are, whether you have a nickel in your pocket or $1 billion in the bank. Now, in terms of why I'm bringing all that up is that when you start your career, you're always thinking about, well, what do I want to be? So you pick nursing. So you're thinking about, well, what does nursing mean to me? Okay? And as you'll find as time goes on, you're going to keep asking yourself that. But what you come to realize is that there's certain basic tenets that you're always going to be following. And what I'm going to bring to you today is an essay that was written by someone who was back in, I hate to say back in the day, but back in the day, when you were director of nursing for a facility and there was a nursing school attached to it, you had dual responsibilities. You were the dean as well as the director of nursing. And in the 1950s, in the Bellevue School of Nursing, that person went by the name of Irene Utes. And what was very prominent in terms of her philosophy was education. She had a master's, which was not common back then to have. She also was very much in terms of advocating for the access to care, as well as the idea of compassion, as we just mentioned, in terms of looking at the delivery of nursing. And what I want to bring to you tonight is a short essay that she wrote, and she actually won a literary prize for it. And it came at the end of her career. Well, not that you ever stop being a nurse, because you never stop being a nurse until you can't think anymore, all right? But the idea is that when she left the service, the direct service of Bellevue, she looked back on what nursing meant to her. And she specifically was talking about Bellevue, but it can be applied to anybody practicing. So if you could go to the next slide. Thank you. What does nursing, actually she wrote, what does Bellevue mean to me? It means the reflection of 100 lights on the East River, the glory of a sunrise through the wide windows of an old operating room after a long night on duty, the miracle of birth and the mystery of death, the little cry of a newborn baby, the arms of a small boy who clung to you during his final struggle. It means the peculiar thrill of having a European patient call you sister, the steady satisfaction of having many patients call you nurse. Next slide, please. It means evening playtime with little girls dressed up in paper caps. We don't do that anymore, the caps, but the philosophy or the framework is there. The fun of quieting a restless group of boys by reading stories on a dreary afternoon. The feel of a soft little hand as a wistful child reaches out to you in the dark. The long black lashes of a fretful youngster with an earache who fell asleep when you put your watch under the pillow to tick a lullaby. The moment of a silent prayer with a patient whom you've prepped for an emergency operation. Next slide, please. It means the sobbing of a 10-year-old who only has known Bellevue as home, who didn't want to go away to boarding school. The quiet thank you of an old lady who told you as you arranged her pillows that this was the first bed she slept in for many years. Next slide, please. The first Thanksgiving when probies helped prepare the extras for the patient's trays. The contented murmur of a man from a lodging house bread line who had just reached the ward in time for 2 complete turkey dinners with several servings of all the extras. Next slide, please. It means busy wards and quiet chapels, long corridors and friendly folks, terrific demands and tremendous satisfactions, comradeship and loneliness, the healing of one's own heartbreak in helping to heal the heartbreak of others. It means associations with illustrious doctors and with the most humble patients, with dedicated nurses and inspiring chaplains. Next slide, please. It means night rounds and long evenings at the desks, the clang of ambulances, the rush of a catastrophe unit, the emergency ward pouring out the resources of a great institution to save the victims of disaster. A lasting pride in students and staff who volunteered for duty. Next slide, please. It means the fulfillment of a girlhood dream of being a nurse. The deep satisfaction in having found nursing to be more than one could ask or think. It means the pride of being identified with a great institution. The humility of measuring one's own capacities against demands too great for achievement. The close fellowship with assistants who carry a large share of the load. The loyal friendship of our board of managers. Next slide, please. It means the total commitment of self to an absorbing job. The assurance that if you walk the paths of service with true dedication and devotion, you learn that God walks the corridors of Bellevue, wherever you work, and you need never walk alone. Now, next slide, please. The reason that this kind of, resonates, especially for someone like me and my colleagues that are here, is that even though this was written in the 1950s, I can bring it to today, all right? I can look at Sandy. I can look at the World Trade Center. I can look at a multiplicity of snowstorms, weather disasters. I can look at the fact that we've dealt with different types of epidemics, all in a sense of comradeship, the idea that you're looking at a healthcare team, and part of that healthcare team is the patient, who is the absolute focus. The idea of commitment, the idea of dedication transcends date and time. And in a society today where you're starting to hear about building walls as opposed to bridges, this brings home that these same issues populated throughout the history of the United States. When they talked about European immigrants, those are the people that came through Ellis Island. The Lower East Side, where Bellevue is now, was not gentrified to the level that you see it today. When I first saw it about 40 years, well, more than that actually, but I won't get into it. It was the tenements, right? And people that were trying to make a difference, trying to make a new life for themselves. Places where my grandparents came, and some of my colleagues' grandparents came. And when you're looking now in terms of how immigrants come into the United States, they come through airports, not boats anymore. So when you're looking at areas where you see a high density of immigrants, you're looking at that entry point. So instead of Lower Manhattan, you're looking at the most cultural variety in the United States in terms of a county, which is Queens. And I think one of the gifts that we have in terms of nursing is that, and especially in an urban type center, is that you don't have to take a plane to see the world. All you have to do is go to work, and you get the gift of seeing other people and what they have to offer, and how all of us together Instead of looking at the concept of diversity, understand that variety is really the focus. Why? Because variety is the spice of life. And nursing is a career that is a gift. Not to say that you shouldn't earn a good salary and have good working conditions and all that stuff as well. But the point is that it's a gift that you should not take lightly, and that gift is to be shared with your patients as well as your colleagues. And hopefully you'll be able to share for future generations as well. So nursing has become more diverse itself, well, has more variety itself now, because it's still a female-dominated profession, but we are seeing more men in the profession. And actually at Bellevue, there was the Mills School of Nursing, which was the men's school of nursing, and then in like the 40s, they joined together to become one school of nursing. So, so we're all here to promote quality patient care, but to realize our role in the community and our responsibility to the community, and the gift that nursing brings all of us as practitioners, as well as those who receive our care. So good luck to all of you, and thank you.
Thank you, Ann. That was really very enlightful. Right now, we're going to get on with our white coat ceremony. First, I'd like to acknowledge we have some senior students here that have volunteered to put the coats on this year. Janine, let me say your last name right. Capuano. Okay, I thought so, but just wanted to make sure. Nicole Gelati, Samantha Gossman, Dylan O'Sullivan, Brittany Palmieri, Amanda Prasad, and Jessa Segura. I thank them personally for coming tonight on their own time. And right now, Professor Veronica Merjica, I hope I said it right, and Dr. Alan Brodowski will be doing the presentations.
As you come up and you get coated, we have our photographer, Ken, who is going to take a picture of you. These will be made available for you and your family at no charge, obviously. Or your tuition actually covers it. Sorry, parents. So we just wait until we can get a picture of you, and I think it'll be a memory for you to keep. After you get your white coat ceremony, we believe in technology and education, so the college is giving each one of you an iPad Mini 4 that we hope you can use throughout your career here.
Leila Shaheen. Charlene Waldron. Kimberly Okanome. Melissa Chrysostome. Kyle Vincent Ogaban. Maya Augustivsky. Alexandra Matias. Alexandra Manetta. Victoria Guglielmoni. Paige Petito. Megan Kuhn. Judy Mendoza. Amanda Lee Tran. Kristen Zwasta. Hannah Berger. Andrea Shortino. Samantha Murray. Alyssa Quigley. Andrea Kushan. Eva May. Lori Christoph. Maria Cullivan. Joanne Donnie. Saskia Hussein. Marissa Ramnath. Ludmila Butanu. Jaspal Bhola. Bunmi Omotayo. Ashley Dennis. Esther Lauren Mutolo. Nadia Barney. Sabina Radzapagic. Anna Braun. Jeffrey Harris. Christian Sarnelli. Kaylin Malave. Taina Exil. Eleni Exidus. Shirley Civilny. So can the 2018 graduating nursing class please stand up? Round of applause. Good work, everyone.
So while you're still standing, please turn, because there is an oath that you should take. So if you could turn to that. We look long and hard for this. Okay? Okay, Ken, ready? Let's recite. I will. You can read. We paid a lot of tuition. Okay, we'll do it together. I will consider the welfare of humanity and relief of suffering my primary concerns. Active. Congratulations.
Again, congratulations to everybody. Second thank you to our senior students. Doesn't that sound nice? Senior students? Yeah, good job, guys. At this time, I'm not going to hold you. I know you're all hungry and we were late starting. I just want to acknowledge some people that are here. Then I'm going to turn the closing end over to Dr. Brodowski. But we do have some faculty and staff that are wonderful with our students. First, Kathy Boyd. Kathy, I always get her job. Kathy puts up with students morning, noon, and night, let me tell you. And of course, we have Sister Helen, who is our secretary for many years. We have a newcomer this year. We have Sheila O'Rourke Kimball, who is our assimilation nurse. Another newcomer this year is Professor Estelle Press. And so I don't mess up her name again, I will just call her Professor Roniker, who's the second year here with us. And now let me make sure. Now I have 3 of our adjunct faculty from Bellevue. We have Regina Giles. We have Daphne Bramble. Jean Stryker. And of course, we have Anne Beauvais. And I hope I didn't miss any other faculty members out there. I'm sorry if I did. I didn't see any other coming in. Right now, I'm finishing up for the evening. I'm going to pass it over to Dr. Brodowski to make a couple of exceptional presentations. And thank you all for coming. And please make sure you come back and join us for dinner right after the ceremony. Thank you.
This is going to be relatively quick, I hope. We have a lot to be thankful for. For many of you who don't realize this, it is a great effort to get this program off the ground, even in the second year. So I do want to make some thanks. First of all, I would like to thank Anne Beauvais for her assistance in getting clinical placements and being an instructor and working with our program for so long. So I'd like to call up Anne, and I would like to give you some flowers on behalf of St. Francis College. We also at the college feel that since you students got iPads, we should give Anne. And going through Anne's resume, we realized she wasn't one thing. She wasn't a terrier. So we have provided her with a St. Francis hat and T-shirt, as well as to carry this home. But now she's a terrier. On a more serious note, I would like to thank Sister Helen for working with the department for many years. And this is her last semester here. So on behalf of the college, we have some gifts for her, some flowers. as well, although we are going to give her some instructions as she goes on. Kathy will make sure of this. We're giving you an iPad. When we hired Kathy Boyd, to take the job away from me of interviewing every student, and really assist in building the program, which has grown from no students 2 years ago. So on behalf of the college, a hat and a sweatshirt. So with that, I would like to bring our white coat ceremony to an end. If you would join us, we have catered food in for you. We have provided dinner instead of just coffee, and we have dessert. We also, as you walk in, we have a birthday cake for Florence Nightingale. So please join us for dinner. Hold it.